lifestyle medicine. And it just opened up my mind to a new way of thinking about the way we take care of patients and the way we manage people's care. And I'm going to try to stay on script and maybe do my comments at the end, but I think we, and I'll say we, because I'm still a traditional medicine doctor, we have kind of gotten off course in the way we approach people's care. There is acute illness, you know, you stub your toe, you inhale pneumonia bacteria, and you have an acute illness that requires a quick answer, it's taken care of, and you're better. And then we have something called chronic illness, right? And these are diseases that set up shop in our system and wreak havoc and really start to damage our health over the long run. The problem with our current medical system is that we are not really as skilled at taking care of chronic disease as we are with quick fixes. If there's a surgery for it, a pill for it, an antibiotic for it, we've got that covered. But when it comes to some of the more chronic diseases and illnesses, we are really challenged by that, and we're finding that it's really something we need to address. So I'm Dr. Moore, and A-Pattern Medical Clinic, I have a part-time, small practice that's starting to build where we use this approach in taking care of our patients. Houston, we have a problem. And I didn't do that on purpose, I really was having a problem. So does anyone know what reference that is from?
Apollo 13.
Apollo 13. And actually it's misquoted, it's Houston, we have had a problem, because I guess they were tracking a problem. Google that and you'll see that that's true. But the problem that we have in our culture right now, in our medical community, is that Americans are sicker than they've ever been. Makes you wonder, right? We are the richest country in the world. We have access to all of this information. We certainly have doctors come from all over the world to study here in America. And yet, we Americans are the sickest people on the planet.
Do you think because we're living longer, part of it?
Well, not all of it.
Ailments? No,
Not-
I know that wouldn't be the whole.
I mean, part of it is that, but we also, it's lifestyle. That, you're cutting to the chase, but it's really about lifestyle, so we'll get to that. So we're sicker than ever. Billions of dollars are being poured into digital health, so we have all of these innovations and technologies, but we're getting sicker and sicker, and we're dying younger. And number two, second problem, is that our healthcare is the most expensive in the entire world, and the costs are rising. We can do MRIs and CAT scans, and even on television you'll see commercials for IV medications for migraines or other problems. $30,000 a month, a year for some of these. I mean, really, really expensive care. And so we're sicker, we're costing more, and the scope of it is staggering. Let's see. So, as of 2012, half of all adults, that would be 117 million people, have had one or more chronic health conditions. That's 1 in 4 people. And so what are these chronic health conditions we're talking about? It's high blood pressure, it's diabetes, it's high cholesterol, it might be arthritis, it might be cancer. There are a lot of chronic diseases that are plaguing us, and 1 in 4 of us have those problems. 7 of the top causes of death in 2014 were caused by chronic diseases. So again, historically, it could be that the top causes of disease were, or death was the bubonic plague or some infectious disease that swept in and killed thousands of people. That's not necessarily how it's happening now. Now it's chronic disease. And if you look at heart disease and cancer alone, that accounts for 46% of all deaths. So, these slides just have more information. 50 years ago, only 2 million people had type 2 diabetes. So we've gone from 2 million to 160 million people either are pre-diabetic or have been diagnosed with a degenerative condition. This degenerative condition, diabetes, is essentially a foodborne illness. Not an infectious disease, it's not hepatitis or food poisoning, but it's a type of food poisoning if you think about it, if it's diseasing us that way. And the beautiful thing is that diabetes in particular is often reversible with lifestyle medicine intervention. Now, what do I mean reversible? Diseases have a progression. They go from this point to that point to that point. And if any of you are familiar with diabetes, you know that there are numbers that we use to track it over a period of time. Those numbers can move in one direction, or they can move back in a good direction. Often we depend on medication to make that progress, but very often if we are really aggressive with intensive lifestyle approaches to these diseases, we can reverse the disease, sometimes to the point where people can come off of medication. All right. So there's hope in that. And the truth is, medical doctors, we know that this is true. But the problem is, how do we execute it? Your average family medicine doctor doesn't have the time or the expertise sometimes to really guide patients on how to get things done. If you've been to a doctor's office lately, you know that there are a lot of people in the waiting room, and those poor docs are just kind of getting the job done. How are you doing today? You doing any better? Any side effects on your medicines? Here are your labs. Good, we've gone over that. Any new problems? You write a prescription and you're gone. If you're lucky, they'll look you in the eye. And many of them are kind-hearted. I mean, we all do the best that we can to love our patients and to do right by them. But the truth is that the volume of work that's required for us to do, to really sit down and ask you, so what do you generally have for breakfast? Or how often do you exercise? Or, what are your stress management techniques? Some of those subtleties get lost when you're seeing your 40th patient for the day and you're documenting them all. So I think their hearts may be in the right place, but the way we practice medicine makes it difficult to achieve true lifestyle change. So again, 80%, and this is to me an interesting statistics. 80% of heart disease in this country is preventable. What does that even mean, preventable? It's a staggering number if you think about it, because it's one of the #1 killers. So if the #1 killer is heart disease, and yet 80% of it could have been prevented, there's a big gap in the middle there. There's something missing, right? And what's missing is early detection and reversing these diseases before they really have their impact. Again, the cost is ridiculous. I'm not going to go through too much of this. $3.6 trillion on healthcare. That's 20% of the GDP. A lot of it is spent on chronic disease. Again, cardiovascular disease being one of the major ones, heart attack, stroke, and not to mention lost productivity at work. When people are sicker at a younger age, they're calling in sick, they're not able to produce like they used to, and that of course costs the employers a lot of money. And don't forget, employers in this day and age are paying for the health care of their workers. So not only do they lose money when they don't show up or they call in or they have an event, they're also paying for that care as a business cost, because in this country, businesses pay for their health insurance. So it's expensive. Lifestyle medicine to the rescue. All right. So lifestyle medicine is the use of evidence-based lifestyle therapeutic approaches, such as a whole food, plant-based diet, regular physical exercise, adequate sleep, and stress management. So, you could look at this and say to yourself, this is not rocket science. What's the big deal? Yeah. We know we should all be doing better. But the American College of Lifestyle Medicine, which is a new group within medicine, is finding the power of these approaches. Sometimes you have to go back to the basics, and you realize that the basics actually have more power than some of the extra fluff and the high technology that we add to things. Now, the key is that it has to be evidence-based lifestyle therapy. So I'm not just talking about, general recommendations. There are some specific, tried and true, proven, tested techniques that can really help, say, with heart disease and say with diabetes and other disease processes. So much so that they can be more effective than medication in some cases. But again, our philosophy in medicine has shifted to where we think that there's a chemistry problem, a chemistry answer to every problem. You know, there's a pill or there's a pharmacology that takes care of problems as opposed to going back to the basics of lifestyle medicine.
Dr. Moore?
Yes.
I lost 10 pounds
Yes.
and stopped blood pressure medicine.
See,
Because, you know, I didn't, when I did it, I wasn't planning on that, but it happened.
right. And you know, and we know this to be true.
You know, to be true.
And as doctors, we don't take credit for it. We say, oh, wonderful. If you don't need the medicine, then that's great. We just stop writing the prescription. And I would imagine that it would be helpful if when a person came in, you noticed that they had high blood pressure, if the first thing we did was ran our list. So, how are you sleeping at night? Because we know that sleeping interferes with high blood pressure or can cause high blood pressure. We might ask them, how active are you? Are you still doing your morning walks? Are you still going to the pool? Are you still going to the gym? Do we ask them how much stress they're under? You know, of course, we know that stress can interfere with your blood pressure. Do we test for diabetes and cholesterol? Do we ask about simple things like sugar intake, which can play a role in high blood pressure? We think a lot about salt intake, right? But sugar, and I don't know if you know, but this country sort of dumps sugar into our everything. All of our processed foods are filled with sugar for some reason. Maybe because we have a sugar industry that produces all the sugar and needs somewhere to put it. But that sugar creates inflammation, and that inflammation irritates blood vessels, and that irritation can cause high blood pressure. Google it. It's a part of the process. And yet, yesterday I had a patient. I love to do that. Yesterday I had a patient who has high blood pressure actually, had gained 5 pounds since the last time I'd seen her. She came for a refill of her medicine. And what I like to do now is I'll ask people, they'll say, I'm here for a refill. And I'll say, of what? Because sometimes they just want to get the pill and leave and not even talk about their disease process. So I said, what's the medicine for? Blood pressure. I said, well, why do you have blood pressure? She says, well, you know, I don't know. Maybe it's the 5 pounds I've gained. So she at least was making the connection. But then for some reason we started to talk about a Sonic Oreo blast. Which she says she likes Sonic Oreo blast. And she says, I love those things. And she says, and I like to get the large one. I'm glad you're laughing out loud. I'm glad. So everything is on the computer now, so I'm pulling up her prescription to refill. But I said, why don't we just Google how many calories? No, what I said to her was,
You Googled it.
I said, you don't look like someone who would drink a Oreo blast, especially not a large. It just doesn't seem like something you would do. That's like my way of complimenting her. Why would you do that to yourself? And so I Googled the calories in a large Oreo blast from Sonic. Someone guess how many calories there are in one
1,200.
1,200.
higher.
1,700.
1,700.
I don't know that
That's a whole
That's a
meal.
crime.
That's a whole day.
It is a crime.
That's a crime. No, I mean, there's a part of me that thinks that it is irresponsible and maybe selfish and maybe just rude. I don't know what the adjective is. But 1,700 calories in a recreational beverage that you can get for, I don't know, $4 just seems wrong to me. And so,
I had something similar. I love Starbucks pumpkin spice latte.
it's the season for that too.
And oh my gosh, when I realized how many calories was in it, it was like, I can't remember the amount.
Right.
It's huge.
Right.
It's huge.
So, and again, I'm not a real snob when it comes to food and eating, but I do like to think that there's some things that are beneath me. And I won't mention what those things are because I don't know, But we need to have an awareness and we need to have a disdain for those things that are harming us. Now, if you happen to be a person who loves an Oreo blast, I can understand where that comes from because it's addictive. They make them that way. They're full of fat, they're full of sugar, they're smooth, they're creamy, you know. But if that is one of the ways that our heart disease rates are increasing because of all of the saturated fat in there, that's one of the preventable causes. And I'm sure you ladies aren't addicted to junk food. None of you look like you are. But there are a lot of children who are being raised on Lunchables and snack foods that are not designed in their best interest. They're just not, you know. So lifestyle, this idea that we should eat fruits and vegetables like the lovely ones we have there today, that we should drink water, that we should sleep for 8 hours, that we should get our exercise, right? That we should spend some time in the sunshine so that our vitamin D levels can be normal, so we don't have to take that vitamin D pill, although sometimes you have to take it, but, you know, just embracing the truth that these modalities are not only, that they're vital to our health. All right, so we talk a lot about healthcare reform, and I'm gonna speed through this, but, you know, we talk about healthcare reform, health insurance, who's gonna pay? How are we gonna manage this? You know, all the expenses of taking care of this. As we get older, how does our insurance cover us? What is Medicare gonna cover for? You know, politically, they're talking about Medicare for all or some, or there's a lot of questions out there. And lifestyle medicine creates true healthcare reform in that it is looking to eradicate and stop and reverse chronic disease at its root cause. And if you can do some of that, then you're gonna reduce the cost and you're gonna reduce some of these bad outcomes. All right, rather than just treating symptoms with ever increasing quantities of costly prescriptions and procedures, lifestyle medicine is looking to, again, eradicate the root cause of disease. And again, in our medicine, in our world of medicine, we have gone off course, and I know a lot of you have experienced this. You have one medicine, it causes a side effect, so they give you another medicine to deal with that side effect. Oh, well, that's causing you that, well, let's give you a little bit of that. And then when you go through a person's list, you realize that they're taking a potassium pill to take care of what the water pill was taking care of, and then the gout pill to help with you know, we start to layer it on. Not because we're not necessarily being thoughtful about the care that we give to patients, but because our philosophy is treating symptoms without, again, getting down to the basics and finding out what the root cause of the problems are. So again, at the A Pattern Medical Clinic, again, I'm family medicine. We like to do what we call lifestyle counseling. So we have these group sessions where the group dynamic will begin to learn what recipes work, what exercise they're doing, what stress management techniques. It's just a great way of learning. We also do formal educational sessions in those group sessions. So our lifestyle counselor, our nurse who's trained in that way, will begin that conversation and help to guide people. In the midst of that, you know, people's diabetes gets improved, and again, the group support we talked about. So someone asked me coming in, what does A Pattern stand for? Well, it stands for adequate sunshine, very important. Not only for vitamin D, but for mental health. There's something important about letting the sun hit the back of your eyes to start your day. It has something to do with the way you sleep that next night, your circadian rhythms. It has to do with just your mood. It's a very important but underutilized. You know, we've gotten to a point where we're afraid of the sun, right? We want to put sunblock on, we stay inside, and that's important to have healthy use of the sun. But the sun, we are circadian beings, if that's the word. We work on day-night cycles, and that's an important part of it. Plenty of water, of course, not Oreo blasts for thirst. Water is preferred. Air, just the fresh air. You know, temperance meaning self-control, you know, not overindulging oneself in things that are not good for you. Some people would say a little bit of anything is not bad, but I don't necessarily agree with that. I think there's some things that we should avoid, like the plague, and never touch. But again, self-control, trusting in divine power, understanding that there's a being higher than us, and ascribing to that, and having a certain amount of peace and spirituality is proven to be a helpful approach. Exercise. Some people say that perfect health depends upon perfect circulation. Exercise is what delivers oxygen to every cell in the body. It's what delivers toxins away from every cell in the body. It provides oxygen. It's just the nutrients. Even the medication that we take is delivered by the circulation. And so if we are not exercising to the extent that we can, we are diminishing our health. And one of the hallmark tests that we do at our clinic measures exercise and our fitness. So I'll talk about that in a minute, and I know we're getting close to time. Rest. How many people believe in a good night's sleep? It's transformative, but yet our culture is so, I hear young moms, I'm 53, so I have patients who have the most crazy lifestyle. They're up at the crack of dawn, getting kids on the school bus, you remember those days, going to work, some of them, coming home, going to the ball game until whatever hour, running through Sonic on the way home, or Taco Casa, coming home at 7 o'clock, doing homework with those same kids and then going to bed at, just really, really long days, and we've gotten away from, and then not to mention that everybody's on a device. And so we're distracted, we're busy, and we're not getting the rest that we need. And if you don't know how important rest is, then, pay attention. Because there are certain processes that only happen while we sleep. Do you know that your kidneys do something different while you're sleeping than they do during the day? Just about every organ system is on a day-night cycle. The more you read about this, and again, this is the beauty of studying the lifestyle medicine from a more academic standpoint, it's not just fluff. We all had parents who said, go to bed, you're gonna get old fast if you don't get your sleep. And we know this to be anecdotally true, but the more we study it, the more we realize that there's pure science behind it. You can't lose weight properly if you don't get enough sleep, because your body is doing, again, certain things are happening with your brain at night that cannot happen during the day while you're awake. It just doesn't happen. And then you do without, and then you suffer the consequences. And so, again, that's important. And then nutrition, I think we all understand that if you eat poorly, your body just doesn't have much to work with, as much as it needs to work with for your health. So we try to drive these things home when we do lifestyle medicine. Met test, I'll do this quickly. So one of the things that we do at our office is something called cardiopulmonary exercise testing. It's a functional capacity is just another word for your fitness level. And everybody has, based on their age, a level of fitness that we would consider normal. So when you're 25, we expect you to be doing something different from a heart and lung standpoint than when you're 85. But we can measure how well you're doing by doing cardiopulmonary exercise testing. Do you remember when Lance Armstrong, we'd see him on TV, he'd have the mask on, he's on the bike, and they're trying to, measure all of those fine things, and he's trying to get 5 seconds off of his race? Well, the science of physiology and exercise, those elite athletes use this kind of technology to create real fitness and efficiency. Well, we are able to use that same technology for just average, non-athletic people like myself who need to know, where do my heart and lungs stand when it comes to my fitness? And that's a measure of our health. And when we are able to use that information to target our exercise goals, it will help us to improve our health. So it's just a way that we use, and I'm not going to go into details of this, but obviously this is a picture of the heart. And as we talked about, the circulation of your heart is very important. It's not just the big blood vessels that get blocked, but it's also the tiny blood vessels that feed each muscle cell in your heart. And if you're not getting the proper circulation to the tiny blood vessels, the heart can fail. It's not gonna perform like it should. And you may go to your cardiologist and you have an angiogram and they say, oh, the big vessels are wide open, you don't have any blockages. But if the tiny blood vessels, which they can't really test for, are blocked, your heart is really not as able to respond to exercise challenges. And this is just sort of a microcosm in your heart. Every organ system is affected by circulation, right? So your brain needs circulation, your kidneys need circulation, and your heart is just a model of that. So we do some testing that helps us to understand where people individually stand when it comes to their fitness level, and measure them against their peers. So again, I'm not expecting myself to be as fit as Lance Armstrong is or as an elite athlete, but for my age, I should be in a certain range, and if I'm below that, then I know I have some work to do. And most of us don't exercise as much as we need to. And we wouldn't really know how much we need to unless we are tested so that we can know what is a reasonable goal for ourselves individually. And is that the end of the slides? So that's the end of the slides. Do I have any questions?
I just would like to say I can vouch for Dr. Karen. She's one of the smartest, best, I'm so glad to see you, doctors I have ever known. And she takes up all that time with each patient, and I've got chills thinking about
Yeah.
this.
It's been, yes ma'am.
Do you have cards?
I do, and I'll give those out at the end, for sure, absolutely.